As flu season approaches, health professionals like Maureen Mercer, the immunization coordinator for the Cumberland County Public Health Department, are urging individuals to get flu shots. This year, the shot contains vaccinations against all 3 strains of the flu that are expected to be prominent this season, including H1N1. There is also a special high-dose shot for people aged 65 and older.
The flu season starts routinely anywhere from September to November. It tends to start earlier on the West Coast than it does on the East Coast. We have unfortunately already had at least 2 diagnosed cases of influenza here in Cumberland County. The same measures can be used to prevent the flu as in with the common cold. If you're sick, stay at home. If you're running a fever, you can take whatever you normally would take for the aches and pains and fever. Contain your cough, throw out your tissues, good hand washing, avoid contact with your eyes after you've been sneezing or wiping your nose. The influenza itself, it differentiates every year with a new strain as to what's going to be popular that year to infect people. And unfortunately, it tends to be the extremely young and the extremely old that are the ones hardest hit and the most likely to die from complications of influenza, which is why having shots is a good prevention. Unfortunately, children under 6 months of age are not eligible for flu vaccines because of their age, but anyone who is in a household or is part of a caregiver of an infant under 6 months should definitely get the flu shot themselves. Flu shots are 70 to 90% effective in adults, maybe 66% effective in children. There are actually 2 different doses for the flu vaccine this year. There is the regular flu vaccine, which includes the flu mist, which is for every child generally over 6 months of age. The flu mist is only for those ages 2 through 49 that are perfectly healthy. The nasal flu mist tends to be more effective in children than in adults, and the effectiveness might go up to 80 to 90%. There is a special high-dose flu vaccine available now, which is manufactured for the 65 and older. It has 4 times the amount of antigen in the vaccine. It is the same volume, but it's a stronger dose. And that is because the 65 and older population, which is highest at risk for developing complications and dying from the influenza disease, they don't develop antibodies as readily as younger people, just like we don't tend to heal as readily as we did when we were younger. So the drug company made this vaccine specifically for that target group to improve the effectiveness of vaccine in the senior citizen. Our flu vaccine for the children ages 6 months through 18 are at no charge for those that meet the VFC guidelines, which means they have Medicaid, no health insurance, or health insurance that does not cover the cost of vaccines. Otherwise, the vaccine will be $31. The high-dose vaccine for the 65 and above, a price of $48. Local pharmacies have been having flu vaccine available for 3 to 4 weeks. Some of the pharmacies, you just walk into the pharmacist and ask for them. Some of them want you to request an appointment so they know that you're coming. Some of the grocery stores are having them. They are being given by nurses through different companies. There is a fee. Some of them are within $5 of each other. At the health department, we don't have our vaccine yet. We hopefully will start doing flu shots the first week in October. We are now located next to the Department of Social Services at 1235 Ramsey Street. The immunization clinic is located on first floor at Express Services, which is to the immediate right when you come in the front door next to our pharmacy. You don't need an appointment unless you want one during the lunch period between 12 and 1 or on a Friday afternoon. Fortunately, this year the H1N1 is incorporated with the seasonal flu vaccine. So it's basically an all or nothing vaccine. You have to get both in order to get the shots. A lot of people, because the flu vaccine can make you feel a little under the weather, a little achy, a little feverish, think that that's actually giving them the flu. The flu vaccine is developing antibodies in your body. It's like fighting an infection. So of course you're going to feel a little achy, maybe a little feverish, but you are not getting the flu from the flu shot. And the flu shot also does not prevent you against getting a common cold. So if you're coming down with the sniffles when you got your flu shot and you're feeling worse the next day, it was not from the flu shot. Oh, flu shots have been around for years. The vaccines are redeveloped every year because they have to decide which virus is going to be the most prevalent during that time. It is really necessary for the children that have had no flu shots during previous years and that are under the age of 9, they still need to have 2 doses separated by 4 weeks. I definitely recommend that everyone over 6 months of age come into the health department for a flu shot. And anyone that is in a household, even with a pregnant person, have a flu shot, because we don't want the child to get the flu when it's born, when it's too young to even get influenza vaccine. And one of the advantages here at the health department is that you don't need to schedule an appointment. You can just walk into the clinic. It is first come, first serve. We do accept Medicare, Medicaid, Blue Cross Blue Shield, and North Carolina Health Choice.